I'm Dr. Ben Newman. I study coronaviruses, and let's answer some of your questions. Next question is from Brianna. Hello, Brianna. Let's see. Hello again. All right. I have a couple of questions. My first is that I have some friends who have had COVID and have recovered. Good. I'm glad they recovered. That's good. Would it be safe to hang out with them since they should have the antibodies? Safer, but not safe. And it would depend on what precautions they are taking. So yeah, like I've been saying in some of the other responses, people make a variety of immune responses, and SARS coronavirus 2 actually tries pretty hard to shut down certain components of your immune system. And so you may not make much of an immune response to actually having the virus, which means that people may be susceptible fairly soon again after catching the virus. Something like 2-3 months would be possible. I think eventually we will see cases where you've got the virus even sooner than that. Much sooner than 2 months, I don't think you can accurately tell, just because it would be very hard to tell the old virus from the new virus without a complete genome sequence. I think the risk here is that if they are people who have had the virus and think they're immune, they may be doing a lot of things that are much more risky than you or I would normally want to do. And since they don't know whether they are actually protected, then I don't know. So yeah, that's why it's making my fingers curl up a little bit. Yeah, I don't particularly like the sound of that, I would say. Yeah, it might be safer, but not completely safe. So I think, so the concept I heard, I think on NPR or something, is that risk budgeting. So the idea that you can take certain amounts of risk in your life with respect to COVID, but you can't keep doing risky things and expect to not get COVID. So you got to budget it. If you are going to hang out with somebody who may or may not be immune, yeah, the way to limit that risk and keep yourself under budget is to wear a mask and then hang out with them. But if you do that, that's like maybe a small to medium-sized risk. Then don't also go out for dinner in a restaurant indoors where you're also going to be potentially with your mask off exposed to the virus. And like if you're sending your kids to in-person school, then that's probably your entire risk budget for the family, and so you want to be super careful with everything else. It's like you have a bit of risk, you can spend it, but you can't spend it after it's already gone. That's the idea. And I think, I don't know, I'm going to try to incorporate some of that stuff into my life, because there are certain elements where there is kind of unavoidable risk or risk for a reason. And it's okay if you take those, maybe, but in the long term, you got to make sure that you're balancing the other side of the equation as well and taking extra precautions somewhere else, I would say. So that's it. Okay, second question, two-parter, is are y'all going to get one of the vaccines? Oh my gosh, yeah, as soon as it comes to a time when what is it, 46? I think I'm 46, yeah. Year-old person is allowed just off the street to get the vaccine, yeah, I'll get it. I think in the position I'm starting down in College Station, I think I will be working with enough virus that might bump me up the list a tier or two. That would be nice. But at the same time, I gotta wait my turn like everybody else. I'm not that kind of doctor, not a nurse, and I am definitely okay with the people that are going in and deliberately working with COVID patients. I want them all vaccinated before we start on, other folks, such as myself. That's what I'd say. But yeah, and I'll take whichever one is available first. I will not have a preference. I suppose if somebody said, "Why, here's a beautiful silver platter with all three approved vaccines on it, or four, depending, if we want to include like China or Russia, which one would you like, sir? Which one could we inject you with?" I suppose I'd go Moderna first. Pfizer would be second, and then either any of the adenovirus vaccines. I'd probably go with the Russian one third. Yeah, 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 because it's just a combination of one that is approved in China and one that is soon going to be probably approved in the U.S. So yeah, and it's been tested out pretty widely. Let's see. And the last question is a three-parter. Sorry. Yeah. Let's see. Is if my parents and my family get the vaccine, is it safe to visit inside without masks? Maybe, but there is Canada geese. There is a 2-week period after a person gets the vaccine when they are definitely not protected. That was really clear from the Pfizer vaccine data. They went day by day by day, and the two lines for vaccinated and unvaccinated were getting the virus at the same rate until about 12 days after, in which case the ones that are vaccinated just stopped getting the virus, and the ones that were not vaccinated continue to get the virus at exactly the same rate. Yeah, so if it's been 2 weeks and you're vaccinated, consider that your risk budget, and I think that's all right. If it's less than 2 weeks, then no. Yeah, how terrible, how terrible would that be? Somebody just gets the vaccine, but the vaccine hasn't kicked in time, and they get COVID from you. Oh, yeah, that just feels like a very bad Christmas. And so, yeah, that's why I would say maybe don't do that. Yeah. Yeah, so there we go. And whatever, it's advice. That's fine. Take it or don't. Thanks very much. This has been Ask Dr. Ben.